Hello. YouTube is telling me that I'm live. So, hello everybody, Parenting Genie community. It's Constance, your lactation consultant. I can see my glasses are a little bit mirroring. So it's Wednesday, 6 o'clock again, and I hope that some of you may watch this live or maybe at some stage as part of a recording. Now, today, my topic, as I had already mentioned last week, is breastfeeding in emergencies. And not just breastfeeding, infant feeding, baby feeding. And why do I choose to talk about that? Because I'm currently in Melbourne and we had terrible bushfires. There's still bushfires, and many families had to evacuate. And they often don't know what to do when they have a breastfed baby or when they have frozen breast milk in the freezer. They may not even have to evacuate, but they may have power outage. One of my clients 2 weeks ago had 8 hours no power, and she's exclusively expressing for her baby, and so had stashes of milk in the freezer, which was fine. She was okay because she had a deep freezer and she knew how to not to open the freezer. So I would like to just discuss, first of all, breastfeeding. So breastfeeding can continue absolutely in an emergency situation like a bushfire, and is the most appropriate feeding method for your baby. You may find that the stress can affect not your supply, but the way that your milk flows, which you can imagine. And they feel that their baby is not getting the milk because they feel that maybe the supply has dropped. Well, that's not usually the case. But what we do know is that your milk flow can change due to the stress hormones. So it's good to keep your baby close and let the baby suckle. You could even do a little bit of a breast massage to just get that little stimulation happening so that the milk is starting to flow. Important is also to keep hydrated, and if you do need to evacuate, do it early, because you do not want to get into situations where you have to inhale a lot of smoke or where it is also too late to evacuate. So that's what this talk is all about today. If you need to express, it is a good idea to know how to hand express. Because if you have a power outage or if you need to evacuate and there is no power, then all the gadgets, the electric breast pumps, will not be able to help you. Sometimes a battery operated one can last for a little while, so that's an option. But always go back to some of the basics, and that's hand expressing. So you could just do a little bit of hand expressing and have a few medicine cups with you as well, because you may not be able to store that breast milk, but you can give it to your baby. And that's only if you're not breastfeeding, or maybe if your baby breast feels a bit full and the baby is not feeding so much at the time. Make sure that you stay hydrated. That's really important as well. So, and then if you are bottle feeding, that is much more of an issue, and especially if you're bottle feeding formula. So it's probably a good idea to have a rescue kit ready when you do need to evacuate, if you are in a bushfire prone area right now, or even flooding could be an issue. It's probably going to be coming at some stage again as well to Australia. So some suggestions are to have a tin of formula ready that is not opened, so a closed one, and lots of bottles of drinking water. So not mineral water, just still water in a bottle that you would have purchased from a supermarket. 250 ml bottles are recommended. The other option is to get ready-to-feed formula. Ready-to-feed formula could be part of your evacuation kit. It is sterile and it requires no water to mix, and that would make it the safest option if you need to feed your baby. Water supply. If you use powdered formula, water supply could be really a problem, and so that's why you should have enough bottled water, and preferably for 3 to 7 days. That's also recommended. Now, sterilization would not be possible if you are bottle feeding your baby with formula. So you may find that you could use chemical sterilization, which would be some of these tablets that you could put in water. And the other option is, as I said beforehand, some bottle-fed babies, if you don't have any clean bottles, you could do a cup feed. And that's not pouring the milk into the baby, it's actually letting the baby lap. There is videos online that would be possibly, an option. There's our Breastfeeding Association here in Australia as well. They have good videos on cup feeding. So that's another option for you to feed your baby as an alternative, because that's easy to clean. Now, what to do if you have stashes of frozen milk in your freezer and you have to evacuate? Well, the most important thing is, if you don't need it at the time, do not open the freezer. Leave it unopened and your breast milk will be fine for 48 hours, provided that your freezer is full. So if your freezer is not full, then that would only keep your breast milk frozen for 24 hours. If you know that you may be in the situation, you could fill up the freezer with water bottles. So that would keep the breast milk and all your other food as well frozen for much longer. Now, is it safe to then go back to your home and use that milk? Well, the good news is, take it out and have a look at it. If there is ice crystals in those freezer bags with milk, then it's safe to refreeze it. You don't have to discard it. If it's fully frozen, you have to use it within 24 hours. If your baby can't drink it all, you can use it in a bath, and then you could even refreeze it anyway as a bathing possibility, putting it in bath water at some stage. To prep your freezer, fill the empty spaces with water bottles or crumbled papers and create that thermal mass, it's called. And that keeps the temperature stable for much longer. If you need to evacuate and you need to take your milk with you, use eskies or cooling bags, and you line them with a lot of newspapers and ice packs. You could also use dried ice, but you would have to purchase it from somewhere beforehand, and that is an option for you as well. Okay, now the other issues you may have that is not all about feeding is, what else should you have in your bag if you need to be evacuated or if you need to evacuate? So recommendations on different channels are a quantity for 3 days. For nappies and wipes, about 30 nappies and about 80 to 100 wipes, and 30 disposable bags, because you need to put these nappies somewhere. I repeat, if you're using formula, have either ready-made formula or have an unopened 900-gram tin. and that would be 2 weeks worth of formula. Feeding bottles. You need to have feeding bottles and teats for every feed. So if your baby feeds 6 to 8 times, you would need 6 to 8 bottles a day. And if you have a minimum of 3 days, you definitely need about 24 or 25 bottles. If you do have cleaning supply like Milton tablets or something, then obviously you can use that. Clothing for infants or babies, 3 to 5 changes of clothes and about 2 blankets. Quite important also is hand sanitizer, because remember, you cannot necessarily wash your hands. So before you prepare formula, or even if you prepare your frozen breast milk, you want to make sure that your hands are clean. So hand sanitizer with 60% plus alcohol. Some other recommendations for evacuation is to have some infant paracetamol, just so that you have got something if the baby does feel a little bit unwell. And then it's very difficult to have a pram in an evacuation center, so the best would be a baby carrier. And next week, I think I will do a YouTube session again on a new carrier as well for you, so you have a little bit more information there. So it can be a carrier or a sling, and that means your baby is also keeping close to you. And so, yeah, and other recommendations are to attach a tag to your baby's clothing or carrier with your name and their name and contact details, just in case there is any separation happening as well. You could put some comments in the comment section of this video to find out whether, or to tell me whether you've ever had a situation like that before, that you had power outage and you lost your stash of breast milk in the freezer or other food. Or you could tell me whether you had issues in an evacuation situation as well. Did you evacuate to some friends, or did you actually have to go to an evacuation center? Of course, that's just covering your baby today or your infant. We also have to have concerns with our pets as well, and not all of the evacuation centers would be able to accept pets. So, but that's not for me tonight to discuss that. So if you have issues that you need extra support, there's also the Australian Breastfeeding Association with their 1-800 number if you need some assistance with breastfeeding, because they do have on-call staff, volunteers. And then there's the Red Cross Ready Plan for other emergency plannings in your household. And there's the Maternal and Child Health Nurse Helpline. And of course, last but least, there is Parenting Genie. So we do have also our Facebook page, and you can ask questions there and we get back to you. And also through our parentinggenie.com.au, you can have a look at our website again. There is a lot of information on storing breast milk and also on infant feeding, and also some in emergency situations. So if there is nothing else, I'm just looking at my little cheat sheet so I can give you a little bit more ideas. Yeah, so it's a good idea to have a really large plastic snap block bag where you can store your sterilized bottles that you need to take with you if you have to use that. And paper towels. A roll of paper towels is a really good idea as well. First of all, to dry hands, and also you have a clean preparation area if you need to make up food or bottles or feeds for your baby. Then I think I have pretty much mentioned everything that is important that you may be able to remember. And apart from that, if you have Other issues. So maybe if you have got an older child, taking, some baby spoons and disposable teaspoons for feeding. You can even do milk feeding with that. And bottled drinking water for infants over 6 months of age. So that is something that you can do when your baby's older. And then also non-perishable food for infants that are already on solids, like cereals, like rice cereal or wheat bix, long life milk. Then low salt tinned baked beans, meal pouches for infants such as tuna, rice, or vegetables, vegetable pouches for infants, and baby rusks are not perishable either, so they're quite handy to have as well. Okay, so I hope that gives you a little bit of an idea about preparing for an emergency and to have everything ready if you do need to go. And if you don't need to go and you are affected by power outages, then please be very careful in opening your freezer and make sure that you have a freezer that is full of food, or at least full of things, so that things are keeping frozen for much longer. Yep, that is the end of my talk tonight. I hope that this is useful. And again, look into some hand expressing as an emergency tool to have if that would ever come up. It may not even be that you have to feed your baby. It may be because your breast is uncomfortable and there's too much milk in the breast and your baby doesn't want to feed right now. And then it's really good if you know how to hand express your breast so that you can soften the breast a little bit. Okay, that's it for today. I'll see you in a week's time, 6 o'clock on Wednesday night from Melbourne, and I'll think of another topic. If you have got any ideas, something that you would like me to discuss, then please put it in the comment section. Okay, bye for now.